Dear students, it is the fourth video for week 13 and we are learning about the health conditions in Pakistan. And in this video, we are going to talk about the health system in Pakistan. Dear students, when Pakistan came into being, there were quite less health facilities available to the people. All the major hospitals, institutions, research centers, medicine companies were left with the India. Pakistan had very rare facilities in Lahore, Karachi, Peshawar, similarly in East Pakistan. But their facilities were not available to maximum people. Even though, unfortunately, in the current era, the health facilities are not available for the maximum people. Fine. The health facilities are available only to the rich people, okay, government officers, okay, and the people having on the panel of the different companies. Fine. The common person still are suffering from the health issues, and they have to spend a huge amount of their already little income on the health. Well, health system of Pakistan, based on the structure of the health system, is that under the cabinet is a health ministry. That ministry controls the departments, okay, of health, like research centers, biological centers, hospitals, colleges, nursing colleges, medical colleges, okay, and they also have made a body of the accreditation, professional certifications and rules and regulations. Clear? PMDC, Pakistan Association, Medical Association of Doctors, and clear. So PMDC is a major body under which the doctors serve, and they have to find out the guidance from them. Well, again, the health hospitals we find on in every district and tehsil, and even in union council level, there are health centers available, but they are insufficient, and our health system is already suffering with many problems. Fine. Anyway, the health in the health sector of Pakistan, we find 4 or 5 main theories of medicine practice. Number one, the Western medical style, Western medical approach. We have just known about this, the doctors and psychiatrists and physiotherapists on the Western based latest theory, like MBBS and BDS. This is one lot. Another theory of the medicine practice is homeopathic. A German doctor, Wilmar Schwabe, is the leading person, and homeopathic is another body, another way of medicine. A good many people get treatment from the homeopathic. Then third is the Greco-Arab medicine. Clear? Greco-Arab medicine, which is called natural medicine. We say tib. You are very much familiar of the word Hakim. Fine. Good many people believe in this system and they get medicine. Okay. Number 4, Chinese way of medicine. Fine. And again, for the mental treatment or psychological problems, people go to different saints and walis and peas and all that. Fine. So they are the different healing system in Pakistan. And one thing is agreed that none of the system is ultimate or fault free. There are positive and negative in every system. Clear? And in every system, there are some very good techniques and medicines and therapies which make that clear. Well, let's have there are two divisions of the medicine. Health system under the government control, clear, that government hospitals, clear, in the main cities, under the federal government, under the local governments, clear, government fund them, provide funds, buildings, builds the medical college, research centers, teaching hospitals, training centers, fine. And then administration, that government administrator those hospitals. Clear, when you visit uh, the central hospital or Benazir hospital or the general hospital, and you find a doctor, senior doctor becomes the MS, and similarly a doctor is a registrar, fine. And so they are the administration bodies, personnel from the government. Services delivery, clear, government provides the medicine, okay, pathological research, x-rays and much more. Then the private sector. And in Pakistan, private sector is more active and serving more than the government sector. Clear? Private people invest, they have their administration, okay, and they serve and they get profit. Let's, for example, while living in Rawalpindi and Islamabad, if someone falls ill and is undergoing some very severe conditions, what do you think? Most of the people say, "Acha ji, shifa le jaye." Clear? Shifa, internationally nachated. Ye shifa le jaye. And this is now a common mouth word. Har banda kehta hai shifa le jaye. This is what the standard of there. That is the repute of that medical company. Clear? And that is not a government funded hospital. That is the hospital, perhaps according to some people, according to some, that is the private venture. Private doctors in America decided to provide the healthcare system to the people in Pakistan so that they may not they may not travel to, they don't take the pain of traveling to America, and they provided it, and ultimately it met success. So whatever they are doing, they are facilitating the public, but lastly they are making profit out of it. Okay. And then another very important sector is NGOs, trusts, and philanthropists. NGOs and trusts. You find there are lots of NGOs like Shifa Trust Hospital, non-profitable organization, clear, I Trust, that is LRBT, I Trust in Mandra, fine, and there are so they are the trusts, and from the local funding by the rich people, their alms, उनकी जो खैरात है, सदका है, ज़कात है, उनकी फेवर है, उनसे ये हॉस्पिटल चलते हैं. They're the non-profitable, and you find many organization, and they are doing lot good. And example of the cancer hospitals, kidney hospitals, fine, and many more. So in short, this is all about the health system, healthcare system of Pakistan. Students, I hope you have learned it. Then move to what are the main problems in the health system of the Pakistan. Number one, healthcare infrastructure. That there are health unit is a complete one. That there are different sections. Section one is receiving the patients and registering them, referring them to the concerned department, Okay, then there is a pathology that ये जो tests होते हैं, clear different kind of tests, clear, and then diagnosis, doctors sit and they agree, and then finally is the medication. तो ये 5-6 डिपार्टमेंट बनते हैं. So we find lots of deficiencies in here, that in government hospitals there are quite less people. Okay, number two, there is a huge pressure on the government hospital that if you need an X-ray, you need some kind of ECG in the government hospital, it takes months even. Clear? Because the people, lots of people are in queue. Fine. There are there are many health issues there. Fine. Even in the village, and again in the village, there are quite less laboratories. Okay, and pathological facilities are not available. Fine. So healthcare infrastructure is not up to date. That the hospitals, their rooms and facilities that ought to be there is not available. Okay. Sanitation and hygiene. Sanitation is very important. Then that the major causes of the diseases, according to the germ theory, okay, is that जहाँ पर गंदा पानी खड़ा हो, जहाँ पर गली सड़ी चीजें पड़ी हो, रोशनी ना पहुंच रही हो, हवा ना पहुंच रही हो, तो वहां पर जरासीम पैदा हो जाते हैं, बैक्टीरिया. लेट्स फॉर एग्जांपल ट्यूबरकुलोसिस. ये ट्यूबरकुलोसिस होती वहां पर है जहां पर हवा ना पहुंच रही हो, जहां पर नमी रहती हो, रोशनी ना पहुंचे. देयर द जर्म्स ग्रो. क्लियर? Malnutrition. This is one of the very important thing, that malnutrition गजाइयत की कमी की वजह से कि खाना ठीक नहीं मिल रहा, जो न्यूट्रिएंट्स प्रोटीन की कमी हो गई. Fine. And there are lots of problems which are happening to the people because of the malnutrition. And unfortunately in Pakistan lots of children are undergoing, जो मौजूदा बच्चे हैं, they are lacking in many ways. उनकी ज़हन छोटे रह जाते हैं, short heighted हैं, okay, and they don't have the required quantity of blood in them. Fine. So malnutrition is a very major issue. Infectious diseases, that daily in the third world new diseases happen. कभी corona, कभी malaria, कभी हैजा, cholera. So they are very common, and there is no proper check and management, because they broke out and spread. The reason may be because we are a large number of people and our daily interaction is very frequent. We cannot keep social distance even though we want to do it. Fine. Environmental health hazards. This is what. There are many things like environment. We live in very short rooms. Air is not available. Ventilation is not. Proper light is not coming. Okay. Environment, breathing, lungs problems because of the air, because of the smog and smoke and much more things. Fine. So most of the allergy and the lungs issues are because of this. Dear students, there were some of the common health hazards in Pakistan, and now we move to what are the solutions for the health issues in Pakistan. Every government identifies the issues. Everyone can talk for hours on the health issues, but there is quite less chances of implementation. Clear? बोलते हैं बहुत कुछ है. Health issues are in number. Fine. Number one, we are a large number of people, and government should increase the health budget, which is hardly 5%. And out of that 5%, much of the budget is jeopardized or gobbled, snatched by the corruption. उसमें से भी बहुत ज्यादा जो है वो corruption की नजर हो जाता है. Reduce the cost of medicine. Government should make a proper policy to save the lives of people. and reduce the cost of the medicine. But unfortunately, बड़े अफसोस की बात है that in the last couple of years, medicine is the sector where the government have increased maximum rates. Clear? Panadol was a common medicine and a very good weapon against COVID-19 symptoms. They have increased in their prices, and also they have shortened the supply. Provide the health facilities in villages too. People in the village, they have to come to the big cities, and we find lots of pressure on the general hospitals. Increase the taxes on tobacco and alcohol, that the people who can have cigarettes and can enjoy the alcohol, they should pay the more. Alcohol primarily is banned in Pakistan, clear, and it is against the law. But if there is any possibility, then government should put heavy taxes on this. Raise healthcare standards. Government must ensure that the hospitals have enough resources to serve patients efficiently. Global warming is a major cause of public health problems. Increased greenhouse gas emission from manufacturing and disposal of goods contribute to the global warming. This is an international problem, but there are 50-50 things. अगरचे हम कहते हैं the global warming, suffocation, smoke, and much more, but on the other end, there is a large number of people, and they need food, and they need clothing, and much more. And only the factories and mills can make all that happen. Handmade things are impossible to reach in the hands of everybody. Fine. So that is a 50-50 thing. We cannot say it. It is all up to the government level, not at individual level. Yes, individuals can do certain things. They avoid spreading filth and dirt on the grounds. They should not pollute the running water reserves. Fine. As we find that even our rivers are full of dirt and all that. Recycling and reusing our household goods in an additional measure we can take to mitigate health issues in Pakistan. Yes, dispose the contaminated material or recycle the papers and plastic goods and all others. And in the end, promote vaccines, because vaccines are a very handy tool, are a very strong measure to be safe from the infectious diseases, and it also increases to some extent the immunity. Dear students, मुझे यकीन है कि आपने अच्छे तरीके से समझ लिया है कि health is very important for the human life, and in third world countries like Pakistan, health takes a much amount of our income, and according to the United Nations, health is the primary duty, and every government and state should take this necessary measures and promote it. And above all, we locally should take care of our own health and try to clean our environment and take the necessary measures. Thank you very much.